the things that's important to us in the neurology residency program is that early on in our residents training, they get a chance to rotate through the breadth of subspecialty divisions that we have in the department. So we make sure that we allow scheduled rotations in the PGY2 year so that our more junior residents get a chance to try out movement disorders or epilepsy or neuromuscular diseases, some of the specialties that maybe they don't see in the hospital as much and they're more based in the outpatient clinic. The institute that pertains most to our neurology residents is the Farber Institute for Neuroscience. And within that, you have the departments of neurology, neurosurgery, neuroscience, and other clinical departments, but also basic science and translational research departments. And having all those departments in that institute is really designed so that it fosters collaboration across departments. So there's opportunities to collaborate with your neurosurgical colleagues or in neuroscience. So if someone has an interest in more neuroscience research, it's right there in the same institute. And I think what that institute demonstrates is that Jefferson really values innovation in clinical care and neuroscience research. And I think both as a testament to Jefferson's focus on neuroscience, but also the opportunity it creates for those who are within that institute is really important. It makes us unique. I think an advantage of the size of our program is that our residents get a chance to rotate through the entirety of the department.
We are really fortunate to have a wealth of rotations. You get a lot of experience in the neuro ICU. We have an excellent epilepsy center, a world-class headache center. So you're able to see really a wide variety of diseases and presentations.
The residents really get the opportunity to take care of a diversity of patients, and they also get to take care of patients from a lot of different backgrounds. I think that's really important.
We see patients that speak other languages, patients that speak Mandarin, Cantonese, Spanish, French, and we have the resources to be able to give them care in their language and the understanding of their cultural needs.
We are able to see many cases from the surrounding suburbs and even further out in rural areas.
By virtue of having a large department with really representation across neurologic subspecialties, they're going to get to see patients and work with faculty who have expertise really across the entirety of neurology. So a resident can really get a chance to see how one provider practices, how another provider. And so that diversity of mentorship and teaching, I think, is a real strength of our department and our program.
My best friends are in this program. We're a family. We care about each other, support one another.
I think the atmosphere in our residency program is really laid back, but not at the cost of hard work and dedication. Our residents enjoy spending time with each other. I enjoy spending time with them.
During residency, life happens. It's 4 years, there'll be ups and downs, and these people are always by your side.
At the end of the day, our residents really value taking care of patients, delivering great neurologic care, and being experts in their field.
One thing that's great about Jefferson is really how much they value the residents. Residents are at the heart of the department. Faculty make such a great effort to make sure that you're included, that your voice is heard. They're constantly teaching and making sure that you're getting the most out of the rotation.
I think the thing that sets us apart is our focus on resident input with myself as the program director and our associate program director to talk about how the program is going, what's working well, what's not working well.
Every week we actually have a meeting with the program directors, and once a month with the chair of the department. We talk about what's going on right there at the bedside with our patients and our own education. Every time they change the curriculum, they ask for feedback from the residents who are actually going through it. When we're done with residency, we're going to be out there making those decisions, formulating other programs, and so we know that it's important that all people are involved, and that allows us to be better leaders. The residents are empowered to speak up about things that are working well with the program, things that need to be changed, and they update us on what's going on, and they advocate for us.
We meet regularly as a faculty to talk about the neurology residency program, about the growth of the residents, and the faculty that come to those meetings clearly are invested.
The faculty are also super accessible. They want to mentor you. If they have any research opportunities, they're going to make sure that you are let into the loop. Or also, if you have an idea of your own, they really make sure that you're supported and given the resources to work on your project.
I love living in Philadelphia. I live in Queen Village. I live in a neighborhood just sort of at the top of South Philadelphia here. I walk to work.
The cost of living here is great. I can live in a nice apartment. I walk to work every day. There's so much culture and so much to do in Philadelphia. For instance, I'm able to take my dog on walks, and our walks take us past Independence Hall and all of the different historical homes. And that's just like so beautiful to be able to do that. And that's for free.
The food in Philadelphia is phenomenal. If you think of a type of food, we have it here. Down in South Philly, the Italian food is great, and we're right by Chinatown, and everybody knows about the Philly cheesesteaks, and no matter where you come from or who you are, you can find your place here.
I think the thing I'm most proud of about our residency program is the residents themselves. Residency can be hard work. They go on and do fellowships in every neurologic subspecialty. They go to fantastic institutions, whether they choose to stay here or go and train somewhere else. So I'm proud of the residents, their relationship, their hard work, and I'm proud of the reputation for Jefferson that they are agents of as they go out and train elsewhere.